yourselves a round of applause. How are you all doing this afternoon? Welcome to Funding the Fight Why Sustained HIV Investment Matters. My name is Jotaka, Eaddy, and I'm the founder and CEO of Full Circle Strategies. Some of you may know me from Win with Black Women, and I am so excited for this conversation today. And as a part of my partnership with Gilead Sciences, I am honored to be here with you and these advocates that are here, leaders, change makers, because we are truly, as we have been saying all weekend, made for the moment. In a time when HIV disparities persist and the needs of our communities continue to grow, 39% of people living with HIV and 38% of new HIV diagnoses in the United States. In 2022, despite only representing 12% of the US population. While Black men had the highest rate of new HIV diagnosis, similarly, Black women had the highest rate of new HIV diagnosis amongst women of all races in 2022. So today's conversation is not just about policy, it's about people, it's about lives, and it's about power, something that we talk about all the time. And it's also about sustained investment in HIV prevention and care. What happens when HIV investment falls short, we will have that conversation because it puts us in a very perilous moment and place in our communities. We'll hear from a powerful lineup of speakers, community leaders, advocates, health experts, and cultural influencers, and who will share firsthand how HIV funding impacts their work and the communities they serve. Federal HIV funding directly impacts all 50 states and makes up a significant portion of state health budgets, especially states like Georgia, Texas, Florida, Illinois, that are disproportionately impacted by HIV. For many states, federal HIV prevention funding makes up entirely a vast majority of their HIV prevention budget. So you'll hear today how funding gaps hurt real people, they affect jobs, access to care, outreach efforts, and ultimately the health and safety of our most vulnerable populations. I'm here to remind you that these are not just statistics. They are lived realities. And if we don't share our stories, our communities will continue to be disproportionately affected. I'm really passionate about this. As a Black woman, I am deeply alarmed by understanding and hearing the statistics of how Black women are so disproportionately affected. When I heard the news, I was alarmed as someone who had led nearly over 100,000 Black women on one Zoom in one night, but not know this statistic, and we're not talking about it enough. And so as we talk about this topic today, I hope that we will have a commitment to taking action. And as we talk about the importance of sustained investment, it's critical that we recognize the role of federal leadership in driving change. We're so honored to be joined today by two champions, I call them friends, in Congress who have consistently stood up alongside communities in need. Their voices in Congress have helped policies, and they have also helped to expand access to care. Today we'll be joined by the Honorable Troy Carter, representing Louisiana's 2nd Congressional District. He also serves as the first vice chair of the Congressional Black Caucus. Congressman Carter has been a steadfast advocate for underserved communities and a powerful voice in the fight to ensure that federal investments reflect the urgency of the moment. Later in the hour, we'll be joined by the Honorable Robin Kelly, representing Illinois' 2nd Congressional District. Congresswoman Kelly has been a national leader on health equity, chairing the Congressional Black Caucus Health Brain Trust. Please join me in welcoming the Honorable Congressman Troy Carter.
Thank you. Good morning.
Good morning.
Good afternoon. Days go by fast. But thank you all for being here. Thank you for taking time to be a part of this very critical discussion at a very critical time. I'm proud to represent Louisiana, proud to be here, proud to be a part of the discussion. I want to thank these incredible panelists, incredible leaders for their time, their talent, sharing their lived experiences on how we interface, the intersection between government, community, Congress, the stakeholders, and the people most at need. Everyone plays a role. Give these incredible people a round of applause. I want to particularly say a special thank you to Gilead for being our partner, resource partner for this event today. And a huge thank you to my fraternity brother and good friend, Jay Jackson. Where are you, Jay? He's working, I guess, still. But thank you for having me here as a member of Energy and Commerce Subcommittee on Health and co-chair of the Men's Health Caucus, ensuring access to quality health care, fighting health disparities, and preserving funding for critical research, particularly HIV research, are top priorities of mine. Numerous barriers to healthcare access exist in communities of color, including stigma, general distrust, healthcare institutions, lack of health insurance, traveling longer distances for healthcare, and so many other things that while there may be factors in other communities, they're even bigger, stronger, more of a distraction and more of a barrier to gaining healthcare access. To address health disparities, improve health outcomes for risk populations, and to fight HIV epidemics, we must ensure access to HIV prevention and treatment services. That includes PrEP. We must continue to support critical safety net programs to help people in need, like Medicaid, and robustly fund research that is essential to developing life-saving cures and treatments. As a member of the Energy and Commerce Health Subcommittee, I had the honor, dishonor, pleasure, displeasure, depending on how you look at it, to have before our committee Secretary Robert F. Kennedy. I had a nice little sparring match with him. I asked him why were they cutting funds to AIDS research? Why were these grants for research being cut? He said, Congressman, none of it's being cut. I said, are you the Secretary of Health and Hospitals? I am. I said, you don't know about these cuts? There weren't any. So I held up my facts. I said, yeah, they are being cut. And I went down the line and I said this one and that one and this one and that one. And instead of further trying to defend what couldn't be defended, he then doubled down on stupidity. He said, well, we've invested so much money in AIDS research, and yet we don't have a cure yet. So we're not putting any more money behind that. I said, Mr. Secretary, what'd you say? Are you telling me because we have invested, but we haven't found a cure, it's been a waste of money? And then I rattled off all of the advances that have made a difference in our brothers and sisters who are suffering with AIDS to say, we have mitigated the disease. We haven't cured it, but we certainly made it better. People are living longer. We have drugs that help people to be able to enjoy longer, better quality of life. And you think we haven't done anything? I then further said, people are dying because of decisions that you're making. He said, show me one person that's died, and I almost threw up in my mouth. That's the kind of idiotic thing that we're having to deal with. And so I'm glad that you're here today. And I'm happy to have had an opportunity to come by and just say thank you. Just say thank you. Because it is because of people like you who are not going to retreat. People like me who are not going to retreat. I think it was Bruce Lee who said, it's hard to be the person who never gives up. It's hard to be the person who never quits. We're not going to quit. We're going to continue to fight for NIH dollars. We're going to continue to fight for all that 17 plus million people that have been taken off, that are being taken off the rolls because of this big, ugly law. We're going to continue to fight this White House who thinks it's cute to roll back gains that have been made for the American people. We're going to continue to fight against this guy, this orange fella that lives at 1600 Pennsylvania Avenue that thinks it's okay to deny the rights of people that thinks free speech is something to be toyed with at his will, that thinks that our democracy is just a guidepost and not a guideline, that thinks that democracy is something that can be played around, that we don't care about a rule of law. Mr. President, yes, we do. And we're not going to retreat. We're not going to back down. We're going to make sure that resources are available for health care. We're going to make sure that health care is available to people in communities that have historically been left behind. So let me say thank you to Gilead, to these incredible panelists, to all of you. You may often hear me talk about 3 C's, Congress, the things that we will do every day to push back, to fight back. Even though we're outvoted, we will not be outvoiced. I spent 27 hours in a committee hearing pushing back against this big, ugly bill. Yeah, 27 hours around the clock in Energy and Commerce. Robin Kelly, my dear friend and colleague, will be with you in a little while. She was with me in those 27 hours. A couple of days later, we spent 36 hours between Rules Committee and on the House floor. 36 hours around the clock. We may not have the vote, but we have a voice, and we're going to stay at the table as long as it takes. Then the second C, and that's the courts. We'll push back with every fiber of who we are to push back against those things that we deem to be unconstitutional and fight our way through the court system. But then third, you. The third C is for community. That's our professionals. That's our thought leaders. That's our teachers, our doctors, our activists, our everything. Standing together and making sure that we attend these kind of functions, learn from these functions, and then consider yourselves deputized to go out to the rest of the community, activate, motivate, educate, and tell them we will not retreat. God bless you, and thank you for being here.
Well, let's all thank Congressman Carter. Thank you for joining us today, and thank you so much for lending your voice to community, the 3 C's, Congress, the courts, and community. And speaking of community, let me turn to our panelists. I'll introduce each speaker briefly, and we'll dive into our conversation. One that I know that will inspire you, hopefully will inform you, and also mobilize us all. So each one of you in this conversation, you will... Oh, sure, absolutely. Well, you know that's our congressman, so come on, right up here.
He just told me to do it.
You get in the middle.
Right in the middle, yeah. Okay. Let's see. How you doing? Yeah, thank you. Thank you for coming.
All right. Smile, everybody. Staff, are y'all up here?
Right behind you.
Okay. Stay right there. Troy will be fussing at me later. Perfect.
All right.
All righty.
All right. Bless you guys. Thank you.
All right,
Bless
thank
us,
you
yeah.
so much. All right, so we'll dive right into this conversation with everyone. So I'm going to start right here to my immediate right. Raheem Devon is a Grammy award-winning R&B artist. Yes, he is the host of WHUR's, it's the #1 show, The Original Quiet Storm, a member of the Hip Hop Political Health Council, and a longtime community activist. He is a spokesperson for Gilead Sciences. Whether he's on the mic or in the movement, he is committed to elevating love, wellness, and truth. And he is here today as a proud advocate for HIV prevention. Let us welcome Raheem Devon.
Good afternoon.
We're also joined by Mr. Carl Baloney, Jr., President and CEO of AIDS United. Carl was unanimously voted and appointed CEO earlier this summer. He has been at AIDS United since 2015. 2015, that is many, many years. That's at least 10 years now, and has played a pivotal role in shaping HIV policy landscape. And last but certainly not least, let's leave the great ladies for last. Our panel rounding us out is Dr. Toyin Nwafar. She is the Executive Director with Gilead U.S. HIV Medical, the Gilead U.S. HIV Medical Affairs Team. Gilead Sciences is a biopharmaceutical company that has pursued and achieved groundbreaking breakthroughs in medicine for more than 3 decades with a focus on advancing innovative treatments in HIV, viral hepatitis, and cancer. An infectious disease physician by training, she is an advocate for people living with HIV with a deep commitment to ending the HIV epidemic for everyone, everywhere. We are so pleased to be joined by each of these guests. Let's dive in. Let's give them a round of applause. Thank you. So as we begin this conversation, I want to help orient us to federal funding and why and what we are here today to discuss. So each year, Congress annually appropriates funds to departments and agencies. We heard Congressman Carter talk about the process and his oversight over that process. And as they are doing that to all of these agencies across the federal government, they are designated to address HIV prevention, care treatment, and research priorities. Now, there has been very positive trends in the fight against HIV. From 2010 to 2022, new infections decreased by 19%. But in 2022, an estimated 31,800 new infections still occurred in the United States. And not all populations experience the same level of decline in infections. And you heard the statistics as it related to how it impacts Black communities disproportionately. Carl, I really want to start here with you. Why is federal investment in HIV prevention and treatment so critical, particularly right now?
I think as a baseline, I want to go back to the statistic that you mentioned earlier in the start of this conversation, and it's the disproportionate impact on Black and brown folks, right? Mm-hmm. Lives literally depend upon it. We need to save ourselves. No one else is going to do it. Aside from that, investing in HIV prevention, care, and treatment is just a smart proposition. The federal government right now is discussing ways to cut costs, to increase efficiencies, supposedly, but it's on the backs of us, our populations, and we know that the resources invested in prevention, care, and treatment help people live well, help people live long, help people stay in the workforce, build generational wealth. Everything is connected, right? We don't live in silos. Our communities are not alone, be it a various healthcare issue, be it systemic issues like hunger and racism. It's intertwined. Investments are going to make sure that we are prepared to meet the moment, that we're prepared to fight back. It's just critical.
So it's a very important point that you make, but I want to double tap on that. And if you could share a bit more about some of the threats to HIV funding infrastructure right now. I know you've spoken a lot about your work on key programs like Medicaid and Ryan White, and we know there's a big conversation about Medicaid and funding to that right now in the country. How does those threats impact HIV prevention?
Yeah, the threats are existential. The congressman talked about the cuts to Medicaid. There are $1 trillion in cuts to the Medicaid program. That is unprecedented. Medicaid is the backbone of the U.S. healthcare response broadly. It's also one of the biggest components of access to care for people living with HIV. In addition to the cuts to Medicaid, there are proposed cuts in the $500 millions to the Ryan White program across various parts. No surprise, they're singling out initiatives like the Minority AIDS Initiative, the Secretary's Minority AIDS Initiative Fund. They're directly attacking programs that support our communities. And community-based organizations that work in HIV care, treatment, and prevention depend upon those resources, depend upon Medicaid reimbursements, and so do the populations that they serve.
Dr. Nawarfar, I want to go to you because Carl mentioned Ryan White, and you have experience in Chicago working with Ryan White. Can you share a bit more about that experience and just the experience working with Medicaid patients, and how has that informed your perspective on HIV care today?
Absolutely, thank you. And again, I think we've heard stats and we've heard the conversation, but always kind of putting it into the perspective of the person behind those numbers. And I think as we talk about the importance of conversations like this and storytelling and sharing, really personalizing these numbers and drilling down with that. So yes, now I'm with Gilead Sciences in medical affairs, again, knowing that, innovation is great, but we know that products don't end epidemics, right? Products with programs and partnerships and conversations. But I'm an infectious disease physician by training, and I've been taking care of people living with HIV for 3 decades now. I was an intern in the hospital in the early 90s and seeing people with very late HIV diagnosis with very few advances at that time in terms of therapy, and just seeing how far we've come, right, to that, and making sure that we do not reverse those gains. Really important that we cannot do that. And where I practiced for almost 3 decades, Ryan White was the biggest coverage for our patients living with HIV, but also Medicaid is about 40% or more, right? Or globally, 40% of people living with HIV, I think, are covered by Medicaid in the US, but where I practiced, it was about 70%, right? So these funding cuts and things around white are devastating, like you said, because they're cutting parts not just of access to treatment and medications, but also testing and linkage to care and prevention services. And some of the stuff that's being looked at in round white is going to cut training, right? A big part of training the healthcare workforce, public health clinicians taking care of people with HIV, dental care, things that are important, but also early intervention services, from testing to linkage to care. They're looking at cutting funds that affect people that are pregnant living with HIV and HIV testing. So these cuts are devastating on a personal level, but also on a community level, because as we think about it, many people that work in HIV have very personal connections to doing this work. And so these communities, when these organizations lose their grant funding and lose their funding, people are let go. So the economics of that community, the jobs, the opportunities are lost. People are lost to care, which means they cannot access their treatment and prevention. We know that when people are suppressed and doing well with their HIV, and they're undetectable, they're untransmittable. They can no longer transfer or transmit HIV to their sexual partners. All of these things will be lost if people are not able to take their medications, or if they don't have support services to get them to care. Prevention, we've talked about. So I know we'll go a little bit into more, but these cuts are devastating. They will set us back decades of progress, and they have impact on the lives of individuals, their families, their communities. So as we have these conversations, we need to think about it from an equity lens of what is right to do, but also if it needs economics to show them the data, the numbers, and what it actually means to the workforce, to hospitalizations, if people are not able to access treatment. So I'm glad we're having this conversation, but these are very personal, and they're really, we have to keep the conversation going.
Yeah, politics, all of this policy is very personal. Thank you for helping us understand these programs and how importantly they help people live well with HIV. You've also discussed in your work and very publicly the needs and challenges of people living with HIV, but I want to lean in a bit, particularly as it relates to Black communities and the disproportionate impact of Black communities. Where are we today in terms of the tools to prevent HIV, and how can we ensure that there is positive innovation that is truly going to help us in this epidemic?
Absolutely. So again, we've talked about decades now of innovation in treatment, in prevention, and we do have the tools to end the epidemic. We have the medications, the partnerships, but I want us to all of us in the room just have this visual, right? This visual of what we call status neutral care for people living with HIV or vulnerable to HIV. And that anchor starts with HIV testing, right? And that means that everyone in this room, everyone in the world has an HIV status. Either you're living with HIV or you're HIV uninfected. And either way, right? So HIV testing, now that's been targeted, right? Along that is when people test and they test positive for HIV, we have amazing, incredible medications to get them linked to care, started on treatment right away, help them stay suppressed so they're undetectable, which is great for their personal health and for the health of their sexual partners. amazing, right? On the other end of that is if you test negative, that there is pre-exposure prophylaxis or PrEP, of which there are now options to keep people HIV uninfected. But all of these things require HIV testing. They require humans and people and intervention specialists and navigators and all of that. What we know is that, like was said, there's about 31,000 new HIV infections every year, but about 39,000 new HIV diagnoses. What that means is that there are people who are diagnosed for the first time who've been living with HIV, hadn't been tested. 1 in 5 people are still coming in with a late HIV diagnosis. What that means is they're coming into the hospital, to the emergency room, with an opportunistic infection, with a cancer, with a complication, because they never had access to testing or were unaware of it, right? And all of these numbers, in terms of linkage to care, viral suppression, access to care, Black people are disproportionately impacted. 40% of new HIV diagnoses and people living with HIV are Black individuals in the US, right? So that's a disproportionate impact. When we look at pre-exposure prophylaxis, Black people are less likely to be on pre-exposure prophylaxis. Black women, Black men. So we have the access, we have the tools, but again, there's still a really huge disproportionate impact. And I think that, as was mentioned, a fact that people don't always know is that of all new HIV diagnoses in the US, 1 in 5 are in women. 1 in 5 infections, that's 20%. And of those infections in women, about 50% are in Black women. So this is personal, this impacts all of us. We need to continue to have these conversations. We have the tools, but we definitely cannot reverse the gains we've made, and there's still a lot of work to be done.
Yeah, you're so right. And just as a Black woman, hearing those statistics and the fact that we are not talking about it enough, that's why conversations like this is so deeply important. I want to talk about also the raising awareness about ways in which federal investment can make and support HIV care. And I hope that our audience can take away the idea that we really just, we need to be more open about this conversation. We have to destigmatize this conversation. It has to be a conversation in our families. Because if we're not open and if we don't share our stories, then we can't advocate and understand and know the important investments and programs that we need in our communities. Raheem, I want to come to you because you're here today as a proud advocate for HIV prevention. What inspired you to speak about HIV stigma and prevention?
I mean, hearing the numbers, hearing the statistics, and then, you know, the need to understand as artists, we can do what I call, you know, combining education with entertainment. Edutainment, as I like to call it personally, you know, it's been my personal goal to you know, do my part.
Yeah. Can you elaborate a bit more on just your experience and particularly, and you've talked about this very publicly, your experience on conversations with your medical provider and things and tools that we could have that could make a better conversation in the doctor's office or with our medical provider and also amongst our family and friends? Absolutely.
You know, I first heard about the numbers and you know, how we're being disproportionately affected by HIV from Dr. Hodge, who was my primary care doctor. You know, I was seeking a new doctor. I wanted somebody that was formative, you know, personally looked like me, and I could have those intimate conversations with, and Dr. Hodge, you know, was that person. You know, that's where I first learned about PrEP, which is, you know, a preventative medication, you know, that you can talk to your primary care doctor about. You know, after partnering with Gilead, you know, last year we had the opportunity to align with a tour that I was doing, and you know, they wanted to reach over 30,000 women in a certain period of time. We were able to supersede the expectation and bring awareness to over 47,000 women in less than 30 days.
Oh, wow.
You know, and
yes, that's a hand clap.
so again, you know, but even having a doctor, you know, prior to that, having a doctor that you just feel comfortable talking to about a number of things, I wouldn't have known about PrEP personally if Dr. Hodge hadn't mentioned it to me. You know?
Yeah, thank you for that. So a valuable lesson, have a conversation with your medical provider about HIV prevention, and also have a conversation with your families and particularly your loved ones about this. I think what we've heard from all of you is that this issue, it affects all of us. We all have an HIV status, and we also have an opportunity to act on this issue as well. I want to kind of continue in this conversation. Raheem, I want to come back to you. How can we get other cultural influences like yourself to normalize conversations about HIV in Black communities?
I think it starts now. You know, me as somebody who started my own foundation back in 2012, the Love Life Foundation, we've done everything from, you know, fighting domestic violence. You know, these days I'm speaking on a lot of mental health panels as well. But you know, pushing the narrative that health is wealth. You know, we celebrate a lot of other misogynistic things when it comes to entertainment, not just in R&B, but in hip hop. And you know, I think that celebrating our health and pushing the narrative of, you know, being aware of what's going on in our health and what's going on in our community is very important. But bigger than that, you know, you don't have to be Raheem Devon or anyone on this panel to start a movement, you know, that aligns with, you know, your moral compass and the things that, you know, you're either being affected with directly. You know, I think everybody can say that, depending on what generation you come from, that they have somebody who's been affected by HIV or cancer, you know, for example. So I think it's, again, you don't have to be, you know, a quote-unquote public figure, celebrity to care about community, care about your people, you know. And this is something that I personally decided to do a long time ago, you know, as a musician.
Well, thank you for that. I think a theme of this week is we are all made for the moment.
Yes.
And I want to remind the audience that we will have a Q&A, and so I want you to think about your questions, and there will be members of the Gilead Sciences team that will collect those questions. So before we go on to questions, I want to give you all on this amazing panel, thank you so much. It's been so insightful. One final question, and I'll start with you, Carl. What is needed now in the moment, in this moment?
I mean, we see what's happening, right? We're under attack. We have to push back. We have to speak up. The congressman said it best. You know, we have to use every lever we can possibly pull to keep a sustained fight against these harmful policies that are coming out. I had a conversation about, last week I was in New Orleans at the Fast Track Cities Conference, and we were talking about advocacy and storytelling. And our personal stories are very, very powerful, particularly to members of Congress when speaking to their constituents. But the data that we've been talking about is also powerful, and we have to learn how to pair those personal stories with the data and the impact both on lives and health, but also on budgets. Ensure that our voices are heard and that we can make a difference in that space. I think we have to fight nonstop.
We have to fight nonstop. Thank you for that. Raheem.
I will follow suit and say absolutely we have to fight nonstop. You know, the combination of utilizing the arts, social media, which has been very, you know, is very impactful and is a trendy thing. You know, I think that, you know, the new trend of going viral, the new hashtag, you know, our health being our wealth, and more importantly, you know, getting the information out, bringing awareness, having the conversations about PrEP, you know, talking to the youth. You know, I think all of these things align with what needs to happen, and going down to Congress and lobbying and continue to have these conversations to fight for the funding that's needed. It's just you know, all hands on deck right now.
All hands on deck. Dr. Nwarfar?
I mean, I couldn't say more, and I totally agree with, you know, we got to keep fighting, all hands on deck, and really looking at, you know, pairing storytelling with data, right? Hitting by the equity piece of what is right to do, and also the economics piece. For some people, that's all that's going to matter is economics, and showing them why that matters. Really personalizing this, really working on making sure that the lived experiences of the people who fought this battle to get us where we are, the lived experiences of the people who are living and aging and thriving with HIV, that have volunteered for research and done all this stuff to get us where we're harnessing those stories and helping them be part of telling us why we can't go back in time. It's important, like you talked about with social media and stuff, but also to understand that each of us is an advocate. And I challenge my clinicians and my colleagues all the time that sitting in the exam room and saying, you know, we will always have patients. We'll always have people come to us. But stepping out of where we are to understand where people are and what else we can impact in the community. Each person has a voice. We're all advocates. And we advocate for things that matter to us. We're always negotiating, right? In real life with our kids, with spouses, with partners. So if we think of this as an all of us, and breaking down the silos, right? That, okay, we all have to work together. People in treatment, prevention, because it's all about making sure that people have, you know, awareness, there's access, there's advocacy, and that we always kind of show why this is important on a personal level. And that's what I'm going to say is that make this tangible and personal so people understand the advances, they understand what would happen if we start to put cuts in place and really weave through the narratives of the people who have gotten us to where we are. There need to be partnerships, silos broken down, and really amplifying the voices of the people who are living with HIV and those who are vulnerable to HIV. And just intergenerational partnerships are going to be key, and just harnessing all the resources that we have. And someone said it, you know, closed mouths don't get fed, we need to talk. If you cover something off, you can't fight something if you're not even talking about it. So stigma is such a big part, and I challenge everyone in this room, the more we normalize this, we can end HIV with tools, but we're not going to unless we end stigma. So we need to be able to talk about it openly, honestly, non-judgmental, and that's part of what we do in medical affairs, to make sure we're training clinicians that when people are empowered and they're advocating for themselves, that they do not enter clinical spaces where they're met with judgment, right? So we need to be able to have these conversations openly, because if HIV testing is a big part of that, if we're not even able to talk about sex and sexual health, we're not going to be. So we need to have these conversations. We need to talk about HIV just like we talk about other things. And we know that all of these disparities in HIV, in cancer, in high blood pressure, and diabetes, obesity in all of our communities. So we also need to work across specialties and disciplines. So if our diabetes people and people are looking at food amputation in communities at a high rate, they're also looking at HIV and cancer disparities in those communities. Partnerships with communities, really important. I know I went on a bit longer, but
so many gems.
This is we can't stop.
We can't stop. So this has been amazing. I mean, I think if we put it all together, we have to keep up the fight, all hands on deck, and we are all advocates, and we cannot stop. I think it's a perfect sum of just being made for the moment. Thank you so much. I want to remind the audience that we do have some time for a few questions. If we do not get to your question, our panelists will be available immediately following this conversation to engage, and we also have representatives from Gilead Sciences here in the room as well that can engage with you. And I want to remind the audience that there are resources in the back of the room, and we hope that you can dive deeper into some of the critical information that is there for you. So I know that there have been questions, you've passed them. I think they're gonna hand them. All righty. So, all righty. Okay, so here's our first question. How do we navigate political oppression and opposition when advocating for when advocating for HIV-related investment? Ooh, who wants to take that one? Carl, you just looked dead at me, so.
I feel like I would retire if I could truly answer that question, but I think it's about coalition building. We can't go this alone, right? What we're facing politically is a result of years of planning and coalition building on the right. We have to do the same. AIDS United is a 501c3 organization, but we work with the folks who work with us and who care about us. And so, again, talk to folks in your communities. Advocacy is not just at the federal level, it's also at the local and the state level. There are Y and Right planning groups, there are AIDS service organizations, your local Gilead reps. You can gather information, make a plan, and engage at the local level and stay engaged. I think that's.
Raheem, Dr. Nawafar, you want to jump in there?
I would probably say who your governor is, who your senator is, who your mayor is, your city councilman. I think we're seeing in real time the importance of how much our votes and votes matter.
Yes.
So obviously there's work to be done before the next elections take place. Not just on a presidential level, but again on a local level, where that funding is controlled, where those budgets are controlled. Messaging. I think that branding and different endorsements and whether it's DC Metro or just different things. I come from an era of we were talking earlier before the panel. I remember seeing, not to tell my age, I think I make pretty had some half a century. So, right. But yeah, come from an era. I remember the press conference with Magic Johnson. I remember us losing. As now being in the hot seat, doing the Quiet Storm, the #1 nighttime music show in the DMV, I might add. But growing up listening to Melvin Lindsay and the loss of Melvin Lindsay and how that affected me as a young child, and being aware and conscious and constantly hearing about HIV and knowing your status and the importance of using protection, contraceptives. It seemed like that the messaging over a period of time went away. To the point that you have millennials and a younger generation that some which literally don't know what HIV is, don't know that it exists. Which is a very frightening and scary thing. As a parent, my oldest son is 20 years old. Followed by his brother is 17, my two oldest. So, and knowing the demographics and knowing who's being affected, it's a frightening time. As a parent, as well. So, I think that all of these things are cohesive, and having those conversations with my oldest son, who is, back when it was time to vote, and the importance of that. So, again, we have a lot of work to do, in that space.
Thank you. Well, speaking of voting, we have been joined by Congresswoman Robin Kelly. Let's give her a big round of applause. Representing Illinois' 2nd Congressional District. She is a constant fighter for health equity, and she's also chair of the Congressional Black Caucus Health Brain Trust. Let us welcome Congresswoman Robin Kelly.
Good afternoon, you guys. How are you?
Good afternoon.
Can we give all the panelists a round of applause? I want to thank my friend, Congressman Troy Carter, for co-hosting today's panel. Also want to extend my gratitude to the panel, Jotaka, Eaddy, Carl Baloney, Raheem Devon, and I'm going to say this right, Toyin Nawafar, okay. As you've heard, I know by now, President Trump and his congressional Republicans are attacking our health care, including treatment for HIV and AIDS. These are difficult times, but I will keep telling people, do not get weary. That's what they want. They want you to get lost in the chaos. They want you to give up. They just want you to go home and close your door and just not even deal with this. President Trump, as you know, tries to distract us with ridiculous social media posts, but I am laser focused on issues that impact you. Right now, there's a bully in the White House, and I'm determined to take him on, and we will win. Don't forget that. We will win. It may not feel like that right now, but we will. I've urged the HHS and CDC to release congressional appropriated funds that prevent HIV. These were funds that were already allocated, and they belong to the people. Congresswoman Barbara Lee entrusted me with reauthorizing PEPFAR, and I will not let her or you down. That's my mentor.
That's right.
Who will be here today? I demanded answers on why the administration froze foreign aid funding, which threw PEPFAR into chaos. As you know, PEPFAR has always had strong bipartisan support based on its incredible success at saving lives and strengthening our global relationships. I was in South Africa and at the time spoke to their president. He talked about, how far they've come because of the work that we did. And President Bush deserves the credit, but Barbara Lee and the Congressional Black Caucus were the pushers of that, so we can't forget that. It is disheartening that such bipartisanship has really seemed to broken, and my colleagues have ceded their power, but that's not going to stop us. Congress must help PEPFAR continue its work by providing a strong appropriations to all the HIV programs and conducting effective oversight at the State Department. That's why panels like this are so very important, and you participating are so very important, because we must arm ourselves with resources, information, and knowledge to defeat those who are trying to attack our health care. Continue to share your stories, and please speak up and out for HIV funding and for public health. Thank you so much again. Thank you to the panel. Thank you to the sponsors. We couldn't do it without you.
Thank you so much, Congresswoman Kelly.